This is my audio. Doctor need to take care of patient and write a prescription for them. Some patient, they always have to keep up with their medication. Otherwise, their health issue can become worse, and it can cost them a lot of money to fix a problem. Some patient, they give me at the pharmacy because their medication is not ready. For example, the doctor forgot to call it the medication, or the doctor have not respond back to medication. How can we improve this process? Today, I can tell you there are 3 steps that you can take to give your medication refill. First, you need to know your prescription name or number. Second, you need to call in the pharmacy and tell them that you want to give your medication refill. Third, you need to call in the pharmacy again to see if your medication is ready. Now, you need to know your prescription name or number. So most of the time, most medication have number on the bottle because it makes job easier for pharmacy to locate the medication on file. You also need to check to see if you have any more refill on the bottle based on Teen Health June 2012. Some doctors, they did not give you any refill on your medication. And some medication have limited refill because they are controlled drug. Based on Office of Diversion Control, March 2010. Even when you pick up your controlled medication, you have to show your ID because they want to know who picked up the prescription. Because most of the controlled medication controlled by the government. Now, you know your medication number at the bottom. Now let's move on to the next level. The second step is you need to call in the pharmacy to see if your medication, if you can fill your medication. If you cannot refill your medication or not, the pharmacy associate will tell you immediately. Because sometimes the insurer will not pay for your medication until you run out. But if you don't have any more refill, just tell the pharmacy associate to fax the doctor or call the doctor to give more refill. After they call the doctor, you also need to follow up with your doctor. Because some doctor, they did not respond to pharmacy associate immediately, to the fax immediately. When the patient calls them, they respond quickly. So if you follow up with them, that would be the best option to give your medication refill quickly. Now you already calling the pharmacy, so let's move on to the next level. Finally, you have to check with the pharmacy again to see if your medication is ready. Sometimes your medication is ready, but you forgot to pick it up. So the pharmacy can cancel your medication and put it back in stock. Moreover, if the doctor denies your medication, that means they want to see you before they can give any more refill to you. So you need to talk with them or go see them. If the doctor did not respond back to you, you don't need to be worried. Just ask the pharmacy to see if they can give you any loan for a few days supply until the doctor calls back. Because some patients, they always have to keep up with their medication. Otherwise, their health issue can become worse. For example, those patients who have high blood pressure, low cholesterol, or blood sugar, they always have to keep up with their medication. Now we complete all these 3 steps. Now let's repeat it over again. First, you need to know your prescription name or number. Second, you need to call in the pharmacy and tell them that you want to give your medication refill. Third, you need to call in the pharmacy again to see if your medication is ready. If you follow all these steps, it will not be hard to give your medication refill. Process is the key for learning. The more you practice, the better you get. So no matter what happens, you should find a way to refill your medication. Thank you.